Generally, we consider geriatric spine surgery to be surgery in anybody aged 65 and older. The primary difference about geriatric spine surgery versus other types of surgery simply has to do with the risks involved. As we all get older, we all tend to accrue certain medical risks, and that can play a part in terms of planning for surgery. And so there are a lot of different reasons why somebody may need surgery, but the common thread through all of those is that somebody has developed some kind of problem with their spine that is painful and severely degrading the quality of their life. And these risks are not per se different from surgery in younger patients, but the risks are oftentimes higher. The older we get, the more we tend to accrue certain medical conditions. Sometimes we're taking more medications the older we get. And so all of those things play an important role in our optimization of people before surgery and how we manage people during and after surgery. The primary benefit of surgery is that there's hope. There's hope that you improve. There's hope of regaining a quality of life that's meaningful to you. The best thing to do to prepare for surgery of any size, one is to find a surgeon that you're comfortable talking with and have discussions with that person about what to expect. You want to go into surgery feeling like you know what the other options are, and we've come to this decision together. It's very important that we so-called optimize you for surgery, and that involves us partnering with your other doctors. You may or may not require a hospital stay. If it's a smaller surgery, you may go home the same day or after a night in the hospital. If it's a larger surgery, you may need to be in the hospital for up to a week or more. There's always going to be pain after a surgery, and we certainly don't want people to be in pain, but a lot of the immediate postoperative recovery revolves around safely getting your pain as controlled as we can, while also trying to get you back to doing regular activities of daily living. It's not at all unusual for me to hear from patients 3 months after surgery that they feel much better, they're glad they did it, they wish they'd done it sooner sometimes. But it's also not uncommon for them to be saying at 3 months that they still have some residual symptoms. That's very common, and those symptoms do continue to improve with time. So recovery from spine surgery can be a long process. People do start feeling better soon, but it can take a good year total before people feel like they're completely recovered. I do think it's important to see a specialist for geriatric spine surgery simply because it can be more complex. We are certainly capable of complexity, but more often than not, these discussions and these procedures do become more complex and require a more comprehensive and multidisciplinary approach that engages more than just your surgeon, but your other healthcare providers. You might need referrals to new healthcare providers, and going somewhere where this is something that's done on a daily basis is certainly to your advantage.